Now, from WYDC TV, this is Big Fox News at 10.
New York children are being hit hard by the latest surge in COVID cases in the state.
On Friday, New York's Department of Health released a new report detailing an increase of COVID hospitalizations in children. Between December and January, the number of COVID hospitalizations increased from 70 to 571 kids throughout the state.
We're starting to see more and more children make it to the hospital who have issues with breathing or issues with other medical conditions.
Dr. Justin Nisko of Arnott Hospital says the rise in cases is due to lower vaccination rates among kids. As of today, only 21% of 5 to 11-year-olds and 65% of 12 to 17-year-olds have completed their vaccine series in New York.
COVID-19 is highly contagious, the Omicron variant, and they're not protected, most of them.
Dr. Nisko says the lack of protection puts children with comorbidities at increased risk for hospitalization.
If the younger children have conditions that could be affecting either their immunocompromised, where their immune system is weakened, or they have conditions that affect their heart or lungs, they could have a more severe COVID-19 infection.
With kids returning from winter break, Dr. Nisko urges parents to get their kids vaccinated and follow COVID safety guidelines.
It's always strongly important that if they can get the vaccine, to get the vaccine, as well as the importance of wearing masks, washing hands, and social distancing in public.
The FDA has expanded booster shots for kids aged 12 to 15. Matt Kleinden's Big Fox, WYDC in Corning.
The nation's top infectious disease expert and the head of the CDC faced no shortage of questions and criticism from senators today, with the U.S. logging almost 1.5 million new positive COVID cases yesterday. Lauren Blanchard has more from Capitol Hill.
Boosters will play a major role in protecting our population, at least from severe disease.
Dr. Anthony Fauci of the National Institutes of Health and head of the CDC, Dr. Rochelle Walensky, facing the Senate Health Committee over the quickly spreading Omicron variant as COVID hospitalizations reach a new pandemic high.
We're all alarmed by how quickly Omicron has spread.
Lawmakers laying out where they believe the federal government has misstepped during the pandemic.
The way this administration rolled out boosters was a disaster. You created skepticism and mass confusion.
The CDC has been criticized for confusing Americans with changing quarantine and isolation recommendations.
But I just want to know, straightforward, if someone is exposed to or has COVID-19 and they're vaccinated, what do they do?
Our science has demonstrated that you're maximally infectious 2 days before and 2 to 3 days after. So by 5 days after your symptoms, if you're feeling better, if your fever is better, if your cough and sore throat are better, then on day 6, you can go out, but you have to wear a mask.
The availability of testing also remains a problem. The White House is working to make 500 million free at-home tests available, but some say they're coming too late.
I think the American people deserve answers. Why doesn't Joe Biden have a plan? He promised America he would have a plan.
Starting Saturday, the Biden administration says insurance companies will be required to cover the cost of 8 at-home COVID tests per person per month. On Capitol Hill, Lauren Blanchard, Fox News.
The American Red Cross has announced a national blood crisis for the first time in decades. According to the organization, the nation's blood supply is in record low territory. The Red Cross reported a 34% decline in new donors due to the pandemic. Centers across the U.S. have reported less than a day's supply of certain blood types. Because of this extreme shortage, the organization says it can't always deliver the requested amount of blood to hospitals. The Red Cross is currently urging people to schedule appointments to donate and help with the crisis. A measure that allows non-citizens to vote in local elections in New York City is now law, but the battle over whether the law is actually legal is in the early stages. Matt King spoke to somebody who supports the measure and somebody who is against it.
No person shall be qualified to register for and vote in any election unless he is a citizen of the United States.
Staten Island Republican City Councilman Joe Borelli just read aloud for us verbatim New York State Election Law Section 5-102, which, as you heard, pretty clearly states you have to be a citizen of this country to vote in the state of New York.
I'm very confident, as a matter of fact, that we're on legal ground.
That snippet of law forms the basis of a suit brought by Borelli and other state Republicans in Staten Island Supreme Court last week to block a law passed by the city council allowing the 800,000-ish non-citizens in New York City to vote in city elections.
The law that was passed in the city council is unquestionably unconstitutional.
We fully expect this mayoral administration and the Board of Elections to implement this law as it was passed.
New York Immigration Coalition VP of Policy Anu Joshi stresses the amount of thought, time, and legal research that went into constructing and then passing the Our City, Our Vote law.
This is not something that's been done with haste.
Joshi, Mayor de Blasio, Mayor Adams, and evidently the majority of the city council found it completely legal within both New York State's and the United States Constitution for the city to decide who can vote not for governor or president, but in city elections.
These are New Yorkers who live here, who are raising their kids here, who give back to their neighborhoods in countless ways.
Before we could even have the policy argument of whether you think this is right or wrong, we have to acknowledge that this is founded in state law.
In a statement issued over the weekend, Mayor Adams wrote, "I believe that New Yorkers should have a say in their government and look forward to bringing millions more into the democratic process."
We'll all be better off when they are able to have a say in the direction of this city.
The Board of Elections now has until July to propose a plan for how best to implement the new law by the 2023 New York City elections.
The city council acted outside the scope of the law. I don't believe the Board of Elections may even be able to take the action that they expect them to.
I'm Matt King.
Dangerously cold weather is gripping the Northeast today, prompting alerts for about 15 million people. Mitty Hicks has more from Boston.
The Northeast region getting hit with extreme cold that is expected to reach a wind chill value of minus 40 degrees in some areas. The National Weather Service has issued wind chill warnings and advisories from northeastern Pennsylvania and upstate New York into central and northern New England, where any exposed skin could get frostbite.
In a matter of minutes, you would start feeling any kind of exposed skin start to get frostbite.
Boston's public school system announced on Monday that it will be closed. The high in Boston is expected to be 12 degrees, with wind chills making it feel as low as minus 8, according to National Weather Service forecasters.
Just to prioritize the safety of our students, and especially given the staffing issues that we are seeing in schools and with our school bus drivers as well, we want to make sure there's no risk of students being either out in the cold on the way to school.
I have a high school kid. I understand for the younger grades, it may be, then it may not be able to deal with the cold.
It could feel as low as minus 15 in other areas of Massachusetts, and it could be even colder elsewhere in New England, as forecasters say the wind chill could approach minus 40 in some parts of western Maine.
The trick to staying warm is to have a lot of loose layers. So if you can have a thin layer on the bottom and then maybe a couple more bit thicker layers.
For many locations, this is the coldest air they felt in about 3 years. In Boston, Mitty Hicks, Fox Weather.
Still ahead tonight, it is the first successful surgery of its kind as doctors transplant a pig heart into a human.
This patient was given an opportunity for this experimental transplant with the idea in mind that we didn't know what the outcome might be.
More on this groundbreaking procedure that offers hope to hundreds of thousands of patients with failing organs.
Here's your local stock market update from Big Fox. Now, your Twin Tiers forecast from Big Fox.
Hello everybody, it's Adam Bowles with your weather, brought to you in part by William Attar. Kim has a night off for this evening, but get ready for a freezing night once again. The wind chills are down in the negatives, almost 11 to 10 degree difference from this time yesterday. A freezing night in the teens, so be sure to dress warmly for tonight and also for early tomorrow morning as well. But the wind chill advisory is ceased at this time. But warmer on Wednesday, that's the good news. We're back into the 30s, not the teens, not the negatives again, not as cold midweek as well. And also we do have a rain and snow mix possible as we head to Thursday morning and also Thursday afternoon as well, but not as much. For the morning coffee in the morning, not as cold, back into the teens once again, 16, 17, but still very freezing once again. So dress warmly, put on the very heavy winter jackets. 19, 22, and then gradually getting to the 20s and even the 30s as we head to Wednesday afternoon. Most of the Arctic air is pushing off towards the north, and also we do have high pressure, not as cold for our area as we head to the afternoon hours as well, slowly getting above freezing as we head to the late morning and also early afternoon as well. Still into the teens in the morning, so dress warmly, 22 around 8 o'clock, and then we're back into around 30. The normal high is 34 degrees. Finally, we are above average for tomorrow. Also looking at more sunshine, partly cloudy to mostly sunny skies in store for your Wednesday afternoon. As we head to Thursday afternoon, though, we do have a round of rain and snow mix possible as we head to Wednesday morning and also Wednesday afternoon as well. Here's future radar looking mostly dry for your late tonight and also Wednesday morning and Wednesday afternoon looking pretty good. With high pressure in store, I'm not really seeing much moisture on the forecast until we get to Thursday with that rain and snow mix possible, mixing in for early morning and also for the afternoon hours. Not a big amount of moisture associated with this forecast, maybe about a 30% chance of rain and snow mix falling for Thursday afternoon. So here's a recap for tonight. Very cold, freezing once again with lows back into the teens, so definitely below average. Grab that jacket, heavy winter coats as well. And also for Wednesday, we are warming up. More sunshine, back to above average, back to around 38 degrees for a high. So increasing cloud cover, but some sun mixing in there. Not as cold with high of 38. 39, a chance for that slight chance for a rain and snow mix possible. 39, and they were plummeting once again to 15 on Saturday. Very cold temperatures, gradually getting warmer after that.
A medical breakthrough is providing a glimmer of hope for thousands of people needing an organ transplant. Kevin Cork has more on the historic operation where a pig's heart is transplanted into a human.
It's being hailed as a medical miracle. Doctors at the University of Maryland School of Medicine have taken a pig heart and successfully transplanted it into a human for the first time.
My dad was on his deathbed.
The patient at the center of this groundbreaking procedure, 57-year-old David Bennett. Doctors say the Maryland handyman was too ill to qualify for a human heart, adding that this emergency surgery was the final effort to save his life.
This patient was given an opportunity for this experimental transplant with the idea in mind that we didn't know what the outcome might be.
Previous attempts at putting a pig heart into a human were not successful, with those patients' bodies quickly rejecting the animal organ. But the pig heart used in Bennett's surgery was genetically altered to prevent those complications. And so far, doctors on Monday say Bennett is still faring well, days after his 7-hour surgery on Friday, adding that he has a long way to go, but his condition is giving them hope. Transplants like this could soon become the norm.
He realizes the magnitude of what was done, and talking with him, I've never in my life heard or seen my dad cry.
Medical advances like these are coming at a very good time, with more than 3,800 people undergoing heart transplants in the U.S. last year alone, a record number in the midst of organ shortages.
Bilingual dogs? A new study finds your canine can tell what language you speak. Matt Finn reports.
Turns out man's best friend can actually understand what man is saying. Well, sort of. Researchers in Budapest, Hungary took 18 dogs, some from Spanish-speaking homes and others that spoke Hungarian. Each dog was hooked up to a brain scanner while hearing portions of the popular book The Little Prince, which was played in Spanish Hungarian, and then a version with scrambled audio.
We tested how their brain processes the two languages, whether we see any difference in the brain activity patterns between the two.
The results were astounding. Researchers saw different levels of brain activity in the dogs when they heard their story in their owner's native language compared to the unfamiliar one.
For example, Spanish, some people consider that sounds more as a song. It's a more melodic language. And for example, Hungarian is super steady because of this pattern. So we believe that dogs detect that.
The brain scans also detected different activity when the dogs heard the scrambled audio, leading researchers to believe dogs can even distinguish between speech and non-speech. Experts say these results mark a scientific breakthrough.
This is the first time that we see in a non-human brain the ability to distinguish between languages.
And if you want to try out this test on your own dog, researchers say the older the dog is, the better they'll be at detecting languages.
Tennis star Novak Djokovic says he's still preparing to play in the Australian Open. A judge reinstated his visa on Monday, but an immigration official says he's still weighing whether he can stay in the country. Anna Eliopoulos has more.
Novak Djokovic returned to the practice court after winning a legal battle to stay in Australia for the Australian Open. The tennis star tweeting out this photo and writing, quote, "I'm pleased and grateful that the judge overturned my visa cancellation." But Australia's immigration minister holds the power and is deciding whether to revoke the athlete's visa. Still, Djokovic's family is declaring victory.
I just hope that it will stay like this, that he will be free and he will play.
In court Monday, Judge Anthony Kelly sided with Djokovic's attorneys, who argued the athlete had done all he thought he could do to comply with Australia's COVID-19 vaccine rule.
The retort from the judge was to the Sky, what more could this man have done?
Australian authorities pulled Djokovic's visa last week when he arrived in Melbourne. They determined he did not qualify for a medical exemption from a rule requiring non-citizens to be vaccinated against COVID-19. Djokovic, who is unvaccinated, apparently believed he could enter because he had recently had and recovered from the virus.
We know he's a truthful and rightful guy, and he will never do anything to across any federal or state law anywhere in the world.
The controversy has sparked a debate over Australia's vaccination rules. On Monday, police in Melbourne tried to calm crowds of Djokovic supporters and those who believe he should not be allowed to stay in the country. The 2022 Australian Open kicks off next Monday.
Robots are helping to fill in the staffing gaps at some hotels. Hotels, finding it harder and harder to hire help, are now turning to tech for a solution. Guests at the Radisson Sunnyvale in California may have noticed that hotel's newest employee, a robot, programmed to help the human employees fulfill tasks, making the guest experience better. This machine, most notably, can fulfill guest requests, maneuvering from the lobby all the way to the visitor's door all by itself. Experts say there are many perks to this machine, such as less contact, saving employees time, and not having to tip.
There's guests that like that, the fact that they can have items delivered and not have that contact with a human being. And it's more of an enhanced experience than it is replacing someone.
Room service at the Radisson Sunnyvale has also gotten more efficient thanks to the robot, decreasing delivery times from 30 minutes to about 5. Good Samaritans and sheriff's deputies team up to help save children who fell into an icy pond in Colorado. Dara Bittler has more.
We arrived on scene with a chaotic crowd that were standing around.
This was a team effort.
We found a 6-year-old girl, like they said, not conscious, not breathing.
Even before first responders arrived.
I was just looking out my window and saw a couple kids just walking on the ice pond, and a few seconds later, I just saw them fall in.
Dusty Talavera risked her own life, jumping in what we now know is a 15-foot deep pond.
Before I even realized it, I was out there on the middle of the pond pulling 2 kids out, and that's when I fell in.
She was able to get 2 of the kids out, but got stuck trying to save the 6-year-old girl. That's when a teenager came to their rescue.
There was a young man that threw us a rope and he pulled us out.
Deputies, paramedics, and firefighters took over CPR.
The medics were on scene. It was all hands on deck in the back of the rig.
They say it was a massive relief when the little girl started breathing again.
I have kids of my own. I have an 8-year-old, and the whole time I was there, I was just kind of, I didn't want somebody to lose their daughter.
We were back at the fire station talking about how brave she was, how great the officers did. And gosh, I hope if this happened to one of mine that somebody like her was close by.
Talavera credits the quick response of the deputies and firefighters in saving the little girl's life. They call Talavera a hero.
It's kind of bittersweet, I just pray she's okay.
We want to leave you with a smile tonight. A college student wins big at Christmas. Brian Donahue is a math major from the University of Virginia, and now he's $1 million richer. The lucky student woke up Christmas morning to a lottery ticket in his stocking, only to find it was a winner. Donahue turned in the ticket for the grand prize of $1 million after taxes. He plans to use some of his winnings to help pay for his college tuition. Good for him. From our whole team, thanks for joining us. We hope you have a great night.